from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It is Thursday, March 17th. I'm Alexis Del Cid. Hope you're having a nice St. Patrick's Day. Welcome to All Things Heart. Here's what we have for you today. You're about to meet the unstoppable Terri Allen. She caught COVID at the start of the pandemic. She is still battling heart issues today. We're going to tell you how you can get help if you're in the same boat. And yes, we're all so busy, but can you spare just 15 minutes? We're going to tell you the one activity to add to your workday. It will help you live longer, so that's worth it. And as always, if you have a question or a comment, please share those with us on our Facebook Live, our YouTube channel, or you can email us at allthingsheart@kumc.edu. Today, we want to introduce you to a Kansas City woman who is simply desperate to get the word out to the vaccine hesitant. She's also working to raise awareness about something called POTS. POTS is a nervous system disorder that doctors say is becoming more common in long-haul patients. In fact, during our first interview with her, she had a medical emergency related to her POTS that had us calling 911.
It really feels like something goes woof and falls.
Sitting in her cardiologist's office, Terri Allen describes the moment our first interview with her over Zoom got cut short with an episode that unfortunately has become common for Terri.
Hold on, my heart rate's going up.
Because of the topic, or does this just happen to you?
It just happens. Can I pause this for a minute?
Terri called 911, but then she couldn't speak, so we also called 911.
And I was laying on the floor by the front door waiting for the ambulance. And I remember having the phone on my shoulder because I just couldn't even hold the phone. Slurred speech and confusion.
It was frightening to watch, but for Terri, unfortunately, it was simply another day.
Unfortunately, that's my life now.
It's nothing like her life before. Fitness motivator Terri Allen is here to show us some simple exercises. Before catching COVID in March of 2020, Terri's life was filled with people, passion, and her burgeoning business.
Body weight, you don't have to worry about equipment.
That's Terri with me on Better Kansas City. Her vivacious personality and work as a fitness instructor made her a natural fit as a regular guest, leading fitness and cooking segments. And at the start of 2020, Terri was expanding her brand even further, enrolling in culinary school, launching her own catering and food truck business.
When it's gone, that's when you really realize, like, wow, I had a great life. I was doing some amazing things.
Just a couple of months later, it all came to a screeching halt. What has this done to your fitness business?
What fitness business? I don't have one anymore.
Her life is now a blur of days in bed, the occasional call to 911, and various trips to the doctor.
Since the day I got sick, March 2020, I haven't taught a fitness class, have not trained anyone.
Along with a host of other ailments, Terri has also been diagnosed with Postural Orthostatic Tachycardia syndrome, commonly known as POTS, a debilitating nervous system disorder that manifests as extreme lightheadedness, fainting spells, and rapid, alarming increases in heartbeat. Some days, Terri can't even sit up. And then there's the fatigue. She's tried exercising twice, but after was so exhausted, she slept for 3 days straight. And her hands?
Now I have excruciating pain with my hands where I don't even want to use them.
Red light therapy, not covered by her insurance, gives her relief for a couple of days, and then she says the pain comes roaring back.
How long is this going to last? Is this going to be forever? They don't know.
Unfortunately, she's one of those who's really never kind of been able to overcome this, for the last year and a half now. Hello.
Dr.
Amit Nohiria, an electrophysiologist with the University of Kansas Health System, is one of Terri's doctors trying to help her piece her life back together.
Like what's causing it or how we can stop it.
She can barely keep track of which medications she's taking for which problem.
For heart and fatigue and salt, and you got to drink Pedialyte nobody wants to drink Pedialyte every day.
Deep breath.
Terri wants to share her story publicly to try to reach others who are vaccine hesitant, particularly, she says, in the African American community.
It's not just like catching the flu and you're okay after that. And I was tip-top, super healthy person.
Oh my goodness, what a journey that Terri is on right now. We are so glad we get to check in on Terri this morning, who joins us virtually. Terri, thank you. And we are also joined by an internal medicine physician, Dr. Rebecca Opole, and cardiologist, Dr. Jean-Alfred Thomas. Thank you both for making time out of your busy days to be here. I want to get to Terri right away. First off, how are you feeling this morning? We know it can be up and down. Oh, looks like your mute is on, Terri. Is her mute button on? That's all right. This is life at post-pandemic and during the pandemic. All right, can you hear us now?
I can hear you.
How are you? It's good to see you smile. My gosh, how are you feeling?
Pretty good.
Is today a good day? Did you know when you woke up it would be okay? How are you? How's your energy?
So far, I mean, I've only been awake about 40 or 30 minutes. So yeah, so far, so good.
I want to talk to Dr. Thomas right off the bat. Dr. Thomas, we know that you've a super busy day today. You're working triple duty. I don't even know what that means, but you rattled off all the things on the docket today, so we're going to ask you a couple questions.
Sure.
Is Terri's story common, that you see heart patients because of their COVID years ago?
Absolutely. Certainly it's been kind of an increased predominance of folks coming in with very kind of vague symptoms. Chief amongst those, sense of elevated heart rate, shortness of breath, that is oftentimes not the script. So unfortunately that is becoming more and more seen. There's an observational study actually done in Nature not too long ago showing that amongst individuals over the last several years, we've seen a kind of a marked increase in cardiovascular diagnoses 30 days removed from their primary diagnosis. So we're seeing an echo effect from the infection and then having cardiovascular consequences, unfortunately.
And Dr. Opole, we were just talking, the three of us, before the show started, and I didn't know this, but you work together quite a bit. You often refer patients to Dr. Thomas. You're on the front lines as an internal medicine physician. Do people often come to you too late when you're thinking, my gosh, you should have seen me earlier so I could refer you to a cardiologist?
They initially came late because, of course, nobody knew anything about COVID.
Right.
But I think the more we advertised our post-COVID clinic, we had patients coming in earlier and earlier.
You're their trusted family doctor. A lot of
Exactly.
patients, I would imagine, have been with you for years and years.
Yes.
What are the symptoms they're telling you where you say, hold up, I've got to refer you to Dr. Thomas or a cardiologist at the health system?
The commonest one is the heart rate going up with very little exertion, especially climbing stairs. So that makes it very difficult, Most people live on 2 or 3 levels, and just taking 2 steps, they feel the heart pounding. That's a common one. And then significant shortness of breath.
And Dr. Thomas, is that the POTS that Dr. Opole's patients are describing to her? And what is POTS? I mean, this seems to be something that we keep hearing about that we had never heard about before the pandemic.
Absolutely. Certainly the shortness of breath could be a manifestation of POTS specifically. We have to be considerate of other cardiovascular diagnoses, heart failure. Certain times there are other rhythms can also be a cause of this. In terms of what POTS is, I think the best way to break down what POTS is essentially is that our nervous system is broken down to very simple sensation and motor skills. POTS is more a derangement of that automatic system that controls heart rate, blood pressure, and so forth. And so, unfortunately, when we lose those automatic reflexes, we're more susceptible to inappropriate rises in heart rate, blood pressure drops, and so forth. And so, certainly that can cause a whole host of derangements from someone's quality of life standpoint.
And that's one of the things that's happening to
Absolutely.
Terri. Terri, what's your activity level right now? You said that you tried to work out and had to sleep for 3 days. Have you tried to work out since then?
Yeah, I worked out week before last. But it's not a workout like I used to do 2 years ago. I did a little work in the pool, kept it to about 20 minutes, and about every 3 or 4 minutes I was exhausted. Like I had to actually rest like every 4 minutes. So I've done one pool exercise, and I've gone walking at the park.
Why is this happening to Terri, Dr. Thomas? Why does she get so tired 2 years later?
Certainly one thing that could be, again, is the kind of dysfunction of the person's autonomic system. Again, that automatic reflex system that controls how we respond to stressors, being physiologic. The other part that goes, unfortunately, hand in hand with this process is a great deal of deconditioning. The old, if you use it or lose it. And so when you're this chronically ill for a time, you do have some blunting of your motor, so to speak. And so you're being antagonized by two issues. One is deconditioning. The other one is that your nervous system that allows you to gear stressors isn't working with you. So not surprised to hear fatigue being so burdensome after something that would be considered regular or normal.
And Terri is the kind of person where if you would have told me before all this happened that if Terri had broken an ankle and was laid up for 2 weeks, she's the kind of gal who would bounce back and probably be running a marathon a year after that. But we are 2 years out. I've heard you compare this as something you call post-polio. Talk about that.
So, this is kind of the way I kind of have discussions with some patients is that, many moons ago when there was the polio pandemic, I think we thought of the more acute impact of that disease process. But, certainly there's a phenomenon, post-polio syndrome, which is certainly different from what we're seeing in the long haul subset. But we're seeing these long-lasting sequelae of infections and injuries. And so there are people dealing with the consequences of their prior acute infection. So most similar to long haul, you've got this fatigue, you have nondescript sensation. Sometimes I see patients with tachycardia and that as well. So some minor semblances, but it's more the long-lasting effects of the unfortunate infection coming down the road.
I want to also talk about vaccine hesitancy. That is something that Terri is passionate about addressing, and I'm going to ask you a question about that, Terri, in a minute. But first I want to ask Dr. Apoli about this, because being one of the doctors that's, again, on the front lines, seeing people you might have known for years and years, how do you talk to your patients who are vaccine hesitant and press upon them the importance of this when they're afraid to get the vaccine?
So I usually ask them, first and foremost, why? Because many of them have had other vaccines, the tetanus vaccine, the pneumonia. So I ask them why they're hesitant about the COVID vaccine. And for most of them, really, is the misinformation. And so I tell them that, I respect their decision, their final decision, but I go ahead and give them all the information about the COVID vaccine. And I tell them if they ever want, a good source of information, it would be the CDC.
And are they receptive? You also talked to me about how it's important not to shame people and make them uncomfortable when you're having this conversation.
I don't shame them at all. In actual fact, I tell them that, I think it is important as a patient to question. It's your body to ask those questions. The other issue has been that the vaccine came onto the market too fast.
That's what they feel.
That's what they feel. Mm-hmm. But research on mRNA vaccines has been going on for a very long time. So I tell them that, and then they feel better if they know that I've taken the vaccine, and so have my children. So I really think that it's safe.
So they know their doctor took it. Their doctor felt comfortable enough to have their child vaccinated. And Dr. Thomas, you're nodding your head in agreement, because you know people as well who are vaccine hesitant.
So come from a medical family, and some of the folks that I've actually grown up with had some hesitations for it. One lady in particular who I grew up through my younger years, unfortunately passed away from COVID, giving her some hesitancy from taking the vaccine. So completely agree with Dr. Pole. There is some misinformation that's been going about with the vaccine, concerns for certain processes, i.e. myocarditis, vaccine-associated myocarditis, which when you compare the event rates with vaccine-associated myocarditis, which can happen, compared to COVID-associated myocarditis, you're talking almost 100-fold differences when you get the de novo virus versus the vaccine. So, Yeah, it's a signal, but it's not nearly as burdensome as you would see with the actual de novo virus infection itself, myocarditis that is.
So you are, if I'm understanding correctly, you're 100 times more likely to have heart problems from COVID than the vaccine.
Yes.
100 times more likely.
Some data would say that you see some numbers as high as 100 times more so, yeah.
Terri, you've also talked about people that you know personally who, even though you know them personally, and they've seen what's happened to you, because you got COVID before a vaccine was available. I mean, it was March of 2020 when you got sick. What's it like to see people around you still hesitant when they know the nightmare that you're going through?
Yeah, it's really sad for me, because knowing what I went through, or if they know what I went through, and they're still hesitant, and I ask them why as well. Like, what is your reasoning? And like the doctor said, a lot of it is miseducation, just not having the correct information. And I always remind them though, but how often do you eat out? And do you know what you're eating, when you eat out? You don't know what you're eating there. So why is this any different? And the statistics, the tests, the information tells you that you're more likely to survive COVID if you've been vaccinated. So to me, it just makes sense to me.
And to piggyback on what my doctors here are saying is that there was a recent study out that said you're more at risk of developing 20 different heart-related problems from COVID than anything else. And how many heart patients have you treated that happened because of the vaccine?
Fair number.
Because they were vaccinated, you're not treating very many though. Because of the vaccine, the heart problems are very low, right?
I think with the vaccination, I think the burden of the infection on the system is lowered. I think it's blunted to a certain degree. I guess, everything, there's no guarantee in life, but at least you're kind of mitigating risk,
right,
and you're improving benefit. And so I think if you have a milder case of a symptom, much like the flu, you're less likely to suffer consequences. And we've got data from decades ago showing that people with even flu, heart disease and flu vaccine, folks who get vaccinated with heart disease do better. They just do. That's old data.
So the vaccine is going to make you fare better.
Exactly.
Yes, absolutely.
Terri, you were recently fitted for a heart monitor. I believe that was what was happening when you were in the doctor's appointment you let us jump in on. Do you still have that heart monitor, and what does it show about your heart now?
No, it was, I only had to wear it for 2 weeks. And of course, in that 2 weeks, it showed, I guess, a little tachycardia, but nothing too alarming. So, we stayed on the medication that I'm on, and, they kept everything the same. And
how is your heart right now? Do you feel it beating any differently, or does it just really surprise you when it happens?
It's not a surprise anymore. I know what not to do and what kind of steps, I know steps that will make my heart rate go up as far as flights of stairs, going up and down stairs. And I really just have to stay on my medication. I can't miss doses or take it later, things like that. I have to be really cognizant of what I'm doing.
I want to get to our community questions because, again, we have Dr. Thomas for a shortened amount of time today because you have to go see patients, which is obviously the priority. So Dr. Thomas, I have a question from Bridget Fitzgerald. Bridget just wrote in, how does someone get an appointment with the post-COVID clinic? Should they be referred by their PCP or an appointment with a cardiologist? How does that work, Dr. Apole?
I can answer that question. So you just call the COVID hotline. And I can go ahead and give them the number.
Yes, please
do.
So
913-588-1600.
588-1600?
588-1600. Okay. And initially, all the patients were being triaged. They had to come to internal medicine and then be referred. But we have triage nurses now, and so if you have, a cardiac issue, they'll send you directly to cardiology.
Another question for Dr. Thomas. Dr. Thomas, question on Facebook, have the doctors seen much improvement in POTS patients over time, or does it seem like improvement is only incremental?
Oh, that's a great question. So there is a study some years ago that looking at some individuals, you're looking at about 20% of folks will have, over the span of several years, complete resolution of their POTS. 50 to 55% of folks, usually you have some marked improvement, but not complete obliteration of symptoms. unfortunately, there's about, I believe, like 15 to 19% of folks have some persistence of the burden of the POTS they have. So, you know, there's a grand majority of folks who have complete resolution or if not significant improvement over the years, but unfortunately there could be a fraction of the population just burdened with the symptoms, you know, possibly for life. And so that's kind of the natural history, the epidemiology of POTS overall, but hopefully that kind of answers the question a little bit.
And it's 10:19. I know you have to leave at 10:20.
Sort
I
of,
want to
yeah.
squeeze in one more question.
Absolutely.
This one is from Jim.
Okay.
Dr. Thomas, besides medication, how do you treat POTS?
Oh, great question. Certainly the first steps are relatively conservative. You know, much like Terry, it's encouraging fluid intake, it's encouraging salt liberalization. Hey, make your salt a little salter, which is, again, as a cardiologist, is like telling Superman to touch kryptonite. The other thing too is exercise, and I know she's been engaged in that as well. Typically we tell folks to get into an exercise program, engage in some 30 to 40 minutes of exercise 3 to 4 times a week. Swimming has actually been shown to be very helpful. Lower leg resistance exercising, all that's very helpful. Those are the lion's share of the things you can do to hopefully correct and retrain your body against POTS.
Thank you, Dr.
No
Thomas.
problem.
Dr. Apoli, I'm still keeping you here.
Okay.
You're
No
stuck.
problem.
You're
Yes.
kidnapped. You're stuck here for a little while. Dr. Thomas is going to
All
go
right.
see patients. Terry, I'm keeping you around too because I've got a lot of questions coming in. Thank you so much for your
Thank you
time.
very much.
And the gentleman will escort you.
Awesome. All right.
Stage right.
Stage right. Thank you
But
very
we're
much,
going to
guys.
keep the conversation going here. Maritas has a question for Dr. Opole. She would like to know if you can explain what you think long haul symptoms will look like a year from now, 2 years from now, 3 years from now. I mean, do you have any inkling of what this is going to be like for these patients?
Absolutely. From what I've seen from, you know, my patients, you know, with long haul, it's going to vary. You know, some people only had, you know, loss of sense, you know, of taste and smell. And the good news is that, you know, for the majority of my patients, about a year later, they can now taste food again.
Oh, that is
And
a year,
then-
but at least they can taste food.
Exactly.
Yeah.
I had somebody with, you know, severe brain fog. They had to really cut short their, you know, training because they just couldn't focus. And we had them going to, you know, speech therapy, and they are getting better. And then there are those ones who ended up with very severe, you know, lower extremity weakness or, you know, POTS, who it's taking a little longer. So it's just going to be a matter of time. But I'm hopeful that gradually, you know, they will regain function.
I want to ask
Yeah.
Terry. Terry, how have you improved over the past 2 years? Have you improved?
Oh, absolutely.
That is good. How? Tell us how.
It was much worse. So I'm able to work part-time now, and I've only been working part-time a few months now, I think 2 months. Still not able to do, you know, a 40-hour a week job.
When you say work part-time, are you talking about your food truck, or are you talking about training people part-time and doing all that physical stuff?
No, I'm not training at all. I'm cooking. I'm cooking part-time.
Yeah. So not a full week, but at least you can get back to getting out of the house.
Correct. Not on the food truck yet. I've learned from last summer, heat is also not my friend with POTS. So food trucks are extremely hot in the summer. So we're still trying to figure out what I'm going to do for the summer with the food truck. So I'm working just part-time in a restaurant.
That's interesting about heat, Dr. Opole, because we also had interviewed, and Terry was on with Michaela, another woman who has POTS, a couple of weeks ago, and Michaela realized she probably can't take hot showers ever again until this gets better, because heat makes her spin into it triggers something with her POTS.
Sure.
Denise has a question for Terry. Denise wants to know, and this is probably what a lot of us wonder, how do you keep going, and how are you able to stay positive, and just what do you tell yourself mentally to keep going?
That's a great question. Some days are tough. You know, some days I'm just angry at the whole situation and always ask, like, why did it happen to me of all people? But a lot of prayer. You know, I believe, you know, if God does things for reasons. Haven't figured out this one yet. but I know I'm supposed to be here for a reason. Maybe it was time to take a break from fitness. Who knows? I was actually in culinary school when I got sick with COVID. So maybe it was time to direct my attention to culinary. Who knows? But I stay prayed up. I pray a lot. My husband is very motivating. He keeps me going. He leaves me words of encouragement. My family, my mom is always like, you can do it. You're gonna get better, and so things like that. I try to watch. I watch positive things. I go to positive events. And that's how I stay encouraged.
Oh my gosh, we're all rooting for you, Terri. I have a question on Facebook from Callista for Dr. Opole. What do you tell people who don't trust the CDC? I'm sure you have that conversation, a bunch of different conversations about people who have mistrust in one form or the other when it comes to vaccine hesitancy. Is there something you can tell them?
The CDC has been here, for a long time, and they've taken care of, very many pandemics and, all the vaccinations and all that. So if you are to trust anybody or anything online, it should be the CDC. And, I tell them that I trust the CDC. These are scientists who've done, PhDs, and they're physicians and all, and they have absolutely no reason not to say the truth.
I have a question from Anne. Anne would like to know how many patients you see nowadays that are not vaccinated.
I'll just speak of my own panel of patients. I have to, maybe about 20%.
Okay, so 80% you're finding are vaccinated.
Yes.
And I want to ask Terri. Terri, have you had any progress with trying to reach people in your corner of the world when it comes to getting vaccinated? You and I have been talking for almost a year now about this journey.
Yes, at least the friends that I know that wasn't getting vaccinated before are now vaccinated. Now it's the hurdle of the booster. So a lot of people are like, no, I got the shot, and that, that's it. I got the booster as soon as it was available to me. I will get another one if they release the booster, because I know for certain that I have been around people that were not vaccinated and got COVID, and I was very close to them, and I have not been sick at all. So I truly believe in the shot and the booster, and I'm an advocate for it.
I have a question from Kim. Kim would like to know, Dr. Opole, have you ever known of a virus other than this one that has caused this much long-term damage to the nervous system or the heart?
Oh yes, the polio virus did that.
So it's
to the nervous system.
Polio and
Yes.
COVID.
Yes.
I mean, so COVID's right up there with polio.
Absolutely.
My gosh, and that goes along with what Dr. Thomas was telling us.
Exactly.
Before he left to see patients, is that he calls this similar to post-polio.
Mm-hmm. Absolutely.
I want to wrap up our discussion here with some final thoughts. It's weird to use the word final when this is a continuing journey for you, Terri, but I want to make sure I give you the chance to let us know if there's one thing you want your viewers to know. What would it be?
Oh gosh. Well, I think we all know by now, after a couple of years in the pandemic, that COVID it is a very serious disease, and don't take it lightly. It is not, like I said, it's not like the flu. And please get vaccinated. I believe you should vaccinate. And it really helps. It really works.
Dr. Opole, do you have any final thoughts as we conclude this episode?
Absolutely. So I want to encourage everybody to get the booster. We know that after the second vaccine, your immunity wanes after about 5 months. So whereas numbers of COVID are going down, I think it's important to get that booster. Make sure you have some immunity, so that we don't go in reverse. people don't start getting COVID again.
That's the last thing we want to hear, is
Exactly.
anyone going in reverse after
Yes.
we've come 2 years out of this.
Exactly.
Dr. Opole, thank you. And Terri, thank you so much for taking time and energy to join us and share your story. Man, we are just rooting for you. It's all like rooting for you and praying for you. And Terri, thank you for sharing this journey with us.
Thank you.
Thank you for having me.
Thank you. Have you heard the phrase, sitting is the new smoking? A lot of us are, well, spending most of our days sitting in front of computers right now or screens. You might be doing that right now. But nurse Shirley Verbenek has how sitting can impact your heart health in a big way.
80% of heart disease is preventable, and it's the risks such as smoking or being sedentary. Exercising, even for 15 minutes a day, can be beneficial. It may not sound like a lot, and so some people say, I don't have time. They don't think 15 minutes is that 30 minutes or an hour of aerobic exercise, but even getting up and taking walks around your office, or if you're working from home, walk around the house.
Little things count, and they do add up. And speaking of nurses and doctors, March 30th is National Doctors Day. It's a day to celebrate and honor our doctors for everything they do to keep us healthy and safe. And we have a really cool way that you and your family can send a thank you. On your screen right now is a QR code. When you scan it, it automatically fills in all the information you need to send us a little thank you video. Just follow the instructions in the notes of the email. Make sure to include your name and your hometown. One important note, it's got to be 30 seconds or less, no longer, or it won't load. And we will air those videos right here on air on the Medical News Network. We can't wait to see and share all your messages. Thank you so much for being with us today. Next week on All Things Heart.
It's like Oreo cookies, you know, and ice cream. They just can't say no, and they love, love, love donuts.
Hey, we all have foods that we just can't put down. We're going to tell you the science behind why that happens and the devastating consequences it can have to your heart. That's next Thursday morning at 10. We will see you then.